This, well, who were we talking about?
Who's that handsome couple?
Which one?
These?
Yeah, that was.
Who was that?
Okay, that picture was taken at my sister's house. Sharon said she didn't like this picture because she had cancer and didn't know it. Because she was diagnosed 3 months after this picture was taken.
I'd like to see myself grow old. I mean, I know that may not be the case, but I'd like to live as long as I could. And I didn't want someone else making that decision. You know, there's a greater power that'll make that decision, but not my insurance company. My name is Sharon Hines, and I am an oncology nurse practitioner and a stage 4 lung cancer survivor.
I'm Ralph Street. I'm Sharon Hines' husband. I'm a professional driver. Do you need to know what my health status is? Mm-hmm. I'm very healthy.
As far as Jared and I being involved,
We don't really have a say. She's
no.
the nurse.
No. You know, because we're assuming at this point Sharon and her colleagues are going to do what's best for her. So we trust in Sharon's experience and her knowledge of the whole oncology thing. One of the docs said, you know, that could be one of your downfalls, is that you know too much about the disease, but then again, it could be very helpful.
Stage 4 lung cancer, if I did nothing, my prognosis, about 6 months. With treatment, maybe a year, maybe longer. As I'm processing all this information, I'm thinking, if I don't have long to live, do I want to do chemotherapy up front and maybe only have a 30% chance of it working? There was a newer agent they were also giving along with chemotherapy called Avastin that is an anti-angiogenesis inhibitor, and basically what that does is break down the blood vessels of the tumor, keeps the tumor from growing. Avastin is a drug that needs approval, and the insurance company denied it, and I thought it was just a matter of logistics, that I don't even remember the initial denial.
It's unfortunate. You know, you think you have health insurance, and you go to put your claim in and it's denied. It's just blows you away, especially with a terminal illness. It's just unbelievable that they would deny you treatment that is, it's FDA approved, and it was recommended from her doc here locally, and also from, you know, Dana-Farber Cancer Center in Boston.
I felt desperate. I was angry at them. You know, who are you to make a decision, deny me a treatment, a proven treatment that my own physicians are recommending, and that I personally know what the score is. You know, I'm not a patient who doesn't have all the knowledge. And I thought, I can't let you get away with it. I had called the nurse manager, and she said to me, Cher, have you thought about calling Kevin Lembo? He's the healthcare advocate for Connecticut. And to be honest, I vaguely knew of the office, but had not had any personal contact with them, because that was something that always happened behind the scenes. Our billing person would help with that kind of thing. So I called Kevin. He called me right back, and they walked me through the process of submitting an appeal to the insurance commissioner's office. From there, that appeal goes out to an outside reviewer. It would be a specialist, so an oncologist, who would then make an independent judgment about the use of Avastin in my situation.
You know, they didn't want our hopes to get too high because it had been denied 3 times. Twice.
And this was the final time.
This was our final shot at it, and he said, I don't want you to get your hopes up, because normally if it's been denied twice, most likely that's their decision, you know, is going to remain. But when she called me and they had reversed the decision, it was quite an emotional phone call. I mean, again, you know, I started crying, but it was wonderful news.
Anxiety, the worry, everything was like, okay, you know, if I'm willing to give this the best fight I got, then you guys got to too. And so I was able to get the Avastin with my second treatment.
This is Where We Live. I'm John Dankosky. Governor Rell's proposed budget would close or reorganize several agencies that serve as advocates or watchdogs. Among the proposals, Rell would shut down the Office of Healthcare Advocate, merge the Office of Child Advocate into
early February, I was actually driving to an appointment in Hartford, and I heard Kevin Limbo on public radio, and he was saying that one of Governor Rell's budget cuts was to eliminate their office. And my heart sank. I called Ralph. He had heard it too. So I emailed him when I got home and said, what can I do to help? Kevin then told me there was going to be a public hearing that Monday. So I wanted to go to that. Sharon Hines, Senator Harp, committee members. My name is Sharon Hines. I'm from Middletown. I ask our legislators to seriously consider the consequences of eliminating the Office of the Healthcare Advocate. As my case demonstrates, the insurance company was misguided and uninformed. Over the years, I have seen so many patients and families who were too overwhelmed, too sick, or too intimidated to take on their insurance company. The Office of the Healthcare Advocate is there when people are at their most vulnerable. And in some cases, it may be a matter of life or death. It's probably the first time in my life I just felt so strongly, so passionate about pursuing this and really getting my voice out there, not only for myself, but for all the patients who I've taken care of over the years, who have been too sick, too overwhelmed, too intimidated to pursue this avenue. These are people who need your protection. Insurance companies now more than ever need to be held accountable for their decisions. Without the Office of the Healthcare Advocate, there is no accountability. I and the citizens of Connecticut are counting on you to do the right thing. Thank you.